lot about my favorite skincare ingredients on this channel, but we don't always focus in on the prescription ingredients. So today, that's exactly what I'm gonna do. I'm gonna tell you about the top 5 most popular prescription skincare ingredients. For this video, I partnered with Apostrophe. You've probably heard me talk about them because they're one of my favorite services to get my skincare prescriptions from. If you're not familiar with Apostrophe, I love it. I suggest it to everybody because it just makes your life so much easier when you're trying to get your prescriptions. You basically go onto their website, you fill out a series of questions, basically telling them about your skin history, any kind of issues that you're dealing with, and just anything that's really important for your treatment plan. Then they have a board-certified dermatologist review your treatment plan and also suggest the prescriptions that you should have. And then they essentially give you your prescriptions. It's that easy. You can check in with them. They check in on you. You can tell them how your progress is going with the prescriptions, which is something that I really love. I've actually jumped around from different strengths of tretinoin while under their plan, and it's been so easy and just super helpful. So if you haven't used their services before, I highly recommend it. And if it's your first time, you can actually use my code to get your first consultation for $5 and also $5 off of your first prescription. All right, so now let's get into the ingredients with a little help from board-certified dermatologist and also Apostrophe medical director, Dr. Aimee Paik. Number 1 is an ingredient that you've heard me talk about several times, and that is tretinoin. You've probably heard me talk about retinoids, which is the umbrella term for ingredients that are vitamin A derivatives. So this also includes retinol, which you also hear me talk about often. Tretinoin is also a derivative of vitamin A. It's also known as retinoic acid, and it's usually what we're trying to get to when we start using retinoids. So a lot of the time we'll start off really slowly and really gently with some of our retinoids and then work our way up to the prescription strength. So tretinoin is really that gold standard ingredient that we're trying to work our way up to because that is the ingredient that we're gonna see the most difference in our skin with. It's also the ingredient that has the most studies on it. So we know the most information about tretinoin, and I think it's one of the reasons why dermatologists really love it. Dr. Paik also says that dermatologists just love tretinoin because it's a multifunctional ingredient. It basically treats everything that anyone could come in for, whether they're teenagers or have more mature skin, because it treats acne, it treats fine lines and wrinkles, and also post-inflammatory hyperpigmentation. And the way that it does this is it speeds up skin cell turnover. It actually does stimulate collagen production, which is something that we hear from, a lot of ingredients that they stimulate collagen production, but really tretinoin is truly that gold standard ingredient that does it. But also on the flip side, it inhibits the molecules that break down collagen and elastin. So it's really working in multiple different ways to just make you look better. So it's just the gold standard ingredient from the day I can remember when I got into skincare. It has been the ingredient that all dermatologists have backed. I have not in my career met one dermatologist that does not love tretinoin. If you do get it prescribed to you, the strengths of it can vary, but it goes all the way up to 0.1%, which by the way, I have never actually personally reached. That's usually too strong for me. A lot of dermatologists will say that you should use it every single night if you can work your way to that. But when you are getting started on it, you might want to start on a lower prescription strength, and you also want to use it like 2 to 3 days a week just to see how your skin acclimates to it. Dr. Paik says that typically you'll start to see some improvement in your skin after about 8 to 12 weeks of consistent usage, but if you do have severe acne or fine lines and wrinkles, it might take a little longer to really see those results. As far as the ingredients that it can be combined with, I actually have found that dermatologists love to combine it with other kind of treatment ingredients. So for me specifically, I've had other brightening ingredients prescribed with it, like for instance, with this prescription that I first started on with Apostrophe, they gave me tretinoin at 0.018%, which was really low because they knew that I was really sensitive and I was like kind of a little bit nervous to like dip my toes back into using tretinoin because I do know that there's a little bit of a purge sometimes, and it can irritate your skin if you go a little too strong at first. But then they also put an ingredient that we're going to talk about in a second called Spironolactone at 5% and also tranexamic acid. But after I got acclimated to that, they actually bumped me up to hydroquinone 6% combined with tretinoin at 0.05%, which is also a much higher strength and probably the highest that I've ever gone with my tretinoin prescription. It's basically where I'm at right now. And then they also put in a corticosteroid in there just to really help to keep any of my inflammation down from using that higher percentage of tretinoin. So it's really interesting to get tretinoin from a service like Apostrophe because it can really customize how you're using an ingredient like tretinoin and also the ingredients that you're combining with it. Next up is one of my all-time favorite skincare ingredients, and that's azelaic acid. You've probably heard me talk about azelaic acid a lot because it's also available over the counter, meaning that you can actually get it without a prescription, but it only goes up to 10%. Lots of dermatologists love to prescribe azelaic acid, especially at higher percentages that you cannot get over the counter. So I'm talking like 15% and even up to 20%. And that's because it's a really great ingredient for all skin types, even people with sensitive skin, especially for people that cannot tolerate tretinoin. If you're unfamiliar with azelaic acid, it's actually a dicarboxylic acid. It's a really mild yet efficacious acid, and it's really different from the other acids that are really popular on the market for exfoliating your skin, like your BHAs and your AHAs, which are alpha hydroxy acids. So it's really in a category of its own. Dr. Paik says it's a gentle and well-tolerated ingredient, which is one of the reasons why they prescribe it so much. It's used to treat rosacea, acne, post-inflammatory hyperpigmentation, and melasma, which is one of the reasons why I love it so much. And also, it is pregnancy safe. So for people that cannot tolerate tretinoin, or for anyone that is pregnant, this is a really great ingredient. I think a lot of people associate it with treating rosacea, but it's really great to unclog your pores. It's keratolytic and it's comedolatic, and that basically means that it prevents comedones. So think about your whiteheads and your blackheads. So it's basically unclogging your pores, and it also decreases keratin production. So if you are getting whiteheads or clogged pores, it's going to help to decrease it in that way. But a lot of people don't realize that it's a great tyrosinase inhibitor. That means it prevents the production of the enzyme that leads to hyperpigmentation. And Dr. Paik says it's actually been shown to have the equivalent skin lightening effects as 4% hydroquinone when used twice a day for 4 months. One of the other reasons why azelaic acid is such a great ingredient to add into your skincare routine is because it goes well with other skincare ingredients. You can even use it with benzoyl peroxide, which is almost unheard of because benzoyl peroxide does not play well with other skincare ingredients. You can use it with tretinoin, you can use it with niacinamide, you can use it with salicylic acid. It's just a really well-tolerated ingredient in general. For some people, you actually might feel some kind of an itchiness or a burning sensation when you first start using it, but your skin usually will acclimate to it, or you'll feel it just for that first 5 to 10 minutes after you apply it, but it usually subsides after that. And of course, just like most skincare ingredients, you have to use it consistently for at least 2 to 3 months to really start to see an improvement in your skin. Next up is a really popular acne treatment, and that is spironolactone. Spironolactone can be used both topically and orally. You'll hear about the oral prescription a lot more because it's usually one of those go-to treatments that dermatologists recommend to women, specifically women, when they are dealing with hormonal acne. And that's because spironolactone helps to block the effects of androgen hormones. So think like testosterone, which can usually lead to more oily skin and also to those hormonal breakouts. This also does mean that men cannot take oral spironolactone because it does have that systemic effect on your body, but everyone can use topical spironolactone. Dr. Paik says that androgens are a class of hormones that actually play a big role, major role in the types of acne that both men and women get. So it's great that this ingredient is actually available out there. A lot of the time, dermatologists will treat women's acne with oral contraceptive pills or with spironolactone, and so that's where you'll hear it come in a lot. The main benefits of spironolactone is that, one, it targets the hormonal causes of acne and oil production. So those are the things that I was mentioning that, might be the main cause of your breakouts. For women specifically, it can really improve severe acne and also rosacea. And it's also great to reduce acne that's located on your back and on your chest, which can be a problem also due to hormones. Again, there is oral and topical spironolactone. Topical spironolactone can actually be used by everybody because it does not have the systemic effects on your hormones. But when it comes to topical spironolactone, Dr. Paik does say to think of it more as a booster to your current acne treatment. Next up is an ingredient that I find myself using often because I deal with hyperpigmentation and melasma, and that is hydroquinone. It is a skin lightening agent. It is not a bleaching agent, which I think a lot of people get worried about. It's a skin lightening agent that actually works to inhibit the production of tyrosinase, which is the enzyme that actually leads to your hyperpigmentation. Because hydroquinone is such a powerful skin lightening agent, it's used to treat melasma, which is a type of discoloration of your skin that's formed from different reasons like hormones. But it also helps to lighten discoloration from post-inflammatory hyperpigmentation, and it also lightens up age spots and sunspots and freckles. So it's a really great skin lightening ingredient. So it's not going to lighten your overall skin tone, but it's going to lighten the areas where you have overproduction of melanin. So again, think of the patchiness, the spots, and the discoloration that you might have on your skin. One of the really important notes about hydroquinone, and it's one of the reasons why it's available only by prescription, is that it's best used cyclically, meaning that you use it for a period of time and then you stop using it and then you might get back back on it for another period of time. So it's really important to be under the care of a dermatologist or a professional when you're using it. And again, it's an ingredient that Apostrophe prescribed to me in combination with tretinoin. So I really love that you can get that personalized prescription from Apostrophe. And then last of the popular prescription skincare ingredients is Clindamycin. If you're unfamiliar with it, it's actually an antibiotic that's used to fight bacterial infection. As a medication, you can actually find it used topically and orally, but Dr. Paik says it's usually prescribed topically. Some of the main benefits of Clindamycin is that it targets inflammation, so that redness that you might see from something like acne. It also helps to target the bacteria that causes acne, and then it can also clear clogged pores. So it's usually used to treat inflamed acne lesions, so think about that red acne that you tend to see, but it can also help to improve non-inflamed acne lesions. So again, think like blackheads. One of the really interesting notes from Dr. Paik about Clindamycin is that it can also increase antibiotic resistance. So they tend to recommend using it with a benzoyl peroxide wash or a gel, which I thought was just really interesting because I would have never ever thought of that. When you use it alongside benzoyl peroxide, it actually helps to minimize that antibiotic resistance. So again, this is one of the reasons why it's really important to be under the care of a dermatologist when you are using this type of ingredient. So those are the top 5 most popular prescribed skincare ingredients. A big thank you to Dr. Aimee Paik from Apostrophe and also to Apostrophe for sponsoring this video. I hope this information was really helpful. We were just touching on these ingredients. Obviously, there is so much more to know about them. I even have some separate ingredients, especially about, ingredients like Spironolactone. I have a whole video with Dr. Sam Ellis that you can watch. I'll leave it in the description box below. If you have any questions, you can feel free to ask in the comments. You can also find me on Instagram. I'm at Susan Yara, and I'll talk to you soon.